Recently, it appears that Madison County has been struggling with our wellness from the virus and its variant. And with our county showing yellow, orange, and red on health maps as of late, we went for some nonpartisan clarification. We're speaking today with Dr. Stephen Wright, MD. He's the Madison County Health Officer. So, to understand what is going on right here in our own backyard, Dr. Wright, what are we seeing specifically in Madison County?
I'll give you the numbers for the state, which should reflect all counties, I'm sure. 85% of all new COVID infections are the Delta variant, might be even more.
How does that correspond with the unvaccinated individuals?
The unvaccinated individuals are 99% of the people that are ending up in a hospital. So you could extrapolate and say that's 99% of the people that are getting infected are the unvaccinated. The vaccine protects you against the Delta variant. That is a known quantity. The kicker is the Delta variant is more contagious and more virulent, i.e. deadly, than the original Alpha virus. Now, there is a new variant on the horizon called the MU variant that originated in the country of Colombia, believe it or not, that is now in 47 states in this country. If this Mu variant gets loose out there, and it very well may, I'm predicting it will, we're going to have to go back to square one, find a new vaccine, which they'll do, and then we got to revaccinate the entire population again. But it's just a matter of time before the virus has enough chances to mutate, form all these different variants until one sticks. That's how the Delta variant got so widespread, is because not enough people had been vaccinated. So that Delta variant honed in on those vulnerable people. So bottom line is we would have been out of this most likely by now. We would not be requiring mask mandates. The schools would not be sending their kids home if everybody got vaccinated that qualified from the age of 12 on up. The swabs that are coming back through the health department here in Madison County, half of them are under the age of 20. And I've seen one as young as 3 years old in the last week, swab positive. The kids did not seem to get the infection hardly at all. And if they did, they had minimal symptoms. Now, they still are having minimal symptoms, but there are enough kids out there that have risk factors such as obesity or diabetes. Their risk for serious disease is as great as an adult. And that is who's filling up Riley Hospital's beds right now, because last I heard, they're full.
What is your reaction that these numbers are being thrown at us for the purpose of creating fear, that it's not really as bad as they say?
The old ostrich sticking his head in the sand applies in this case. I'll guarantee you that it is as bad as it was at the height of the initial pandemic, because I'm in touch with the intensivists at both hospitals in Anderson. They're both full, and 99% of the people that are in ICU on vents or in ICU have not been vaccinated. Last week, the emergency room at community hospitals set a new record for visits in one day, and they had 8 people unable to be admitted to the hospital, and they had to take up a bed in the emergency room for up to 18 hours before a bed upstairs became available. Now, this is all unnecessary.
Has there been any dialogue between your office and the county offices?
Not much. What would we say? We're not going to go back into a lockdown. We did this once. We made our point. We slowed the virus down. We got the vaccine in place. We loosened restrictions because the vaccine was making a huge difference. But as soon as we loosened the restrictions, the Delta variant popped up, and nobody got their vaccines after that point. So we stalled out at 52% vaccination rate for the state. We need, I think, at least 75% of everybody vaccinated that's eligible in order to stop this virus before it's too late.
Let me ask you to speak a little bit about the people who are coming up with the cures that they're hearing on social media. Do you recommend the ivermectin and such for people going out to farm supply and getting their own?
What they're doing is they're wasting their money. They're putting themselves at risk with a medication that they don't need, and they're denying some poor animal his worm medicine. Ivermectin, I don't know where it came from. It's been proven over and over again to be ineffective and useless.
Do we do an adequate job of protecting ourselves in Madison County?
We made available the tools that we could have protected ourselves, yes. People chose not to take advantage of it. That's free will, I guess, right?
Yeah.
When I was a kid, when the polio vaccine came out, well, there wasn't a choice. You lined up and you got the polio vaccine. So I don't know where this got disconnected because polio was bad enough, but it was not a pandemic. It was an epidemic when I was a kid.
Let's talk about this in terms of economics.
The cost of a hospitalization versus the cost of the vaccine, there's no comparison. It's at least $50,000 to treat one person with one COVID infection. And if you end up on a ventilator, you can add another zero to that. Some companies who are self-insured are charging unvaccinated employees $200 a month to cover the possibility that they may come down with COVID and require hospitalization. It makes sense. If you refuse to get vaccinated, you're putting everybody at risk at work as well as at your home.
Talk about what you're experiencing with the healthcare providers you know that are working in both of our
Oh, yes.
hospitals.
Both of the hospitals are in a situation of staff shortage. They cannot get enough people to work. One reason they can't get people admitted to the hospital floor is they don't have staff to take care of them. Lots of people have quit. They've retired.
And
Not
why?
because they're sick, but because they're tired.
Dr. Stephen Wright, MD, Madison County Health Officer. Thanks for listening. That's the latest buzz of Madison County.